Testolone RAD140, the ultimate strength booster. RAD140 is known mainly for the dramatic strength gains that it gives you. You will cruise through plateaus, set new 1RM records, and will be able to continue lifting even after you have just crushed your last set. The motivation that this gives you is insane. We remember feeling like shit during our healing PCT after years of blasting and cruising. When we healed completely and were struggling to lift like earlier, this stuff gave us wings. The strength gains and the aggression were almost comparable to gear. We had a very Deca and Trend cycle-like feeling when we were on RAD. How to use. Like most other SARMs, finding the ideal RAD140 dose for you will require some dialing in. Start low and then gradually up it to 30 milligrams a day. It has a half-life of 36 hours, which means that you can do with one single dose or divided doses in 24 hours. The ideal cycle length varies between 10 to 12 weeks. If you stick to a low dose, you can continue for 12 weeks without experiencing suppression. But if you are using 20 to 30 milligrams a day, we recommend that you do not exceed 10 weeks, as this is when the suppression hits you hard. By week 11, you'll be struggling to haul yourself out of bed, let alone go to the gym and lift. This is the time when you should be thinking of a PCT if your blood work demands it. Side effects. Most of the side effects are manageable. There will be the occasional sleepless night, sporadic headaches that fade on their own, and an occasional episode of dry mouth. But it's the mental sides that need a mention here. Some users have mentioned increased aggression while they were on Testolone. While controlled aggression is always great for an intense workout, it starts to get problematic if you are thinking about bashing people for no reason. If you do experience these sides, taper down the dose or take a break for a few days and see if it wears off. Do you need a PCT? The thing with SARMs is that people react differently to it. In most cases, you wouldn't need a PCT with any SARM, but there are some who experienced a near shutdown with LGD alone. Moreover, there's every possibility that your SARM is bunk. In ideal circumstances, your testosterone levels should return to baseline in about 6 weeks post-cycle. Blood work is the only way to know if you are severely suppressed and whether it warrants a full-fledged PCT. RAD140 versus LDG 43.3. That's the perpetual conundrum. Which one of these two popular SARMs do you select for your first cycle? The fact is that both these compounds are very similar in their action and their effects. They are both compared to testosterone. Testolone will give you more strength gains and aggression, while LGD 4033 will be a better mass builder. What are your bodybuilding goals? Pick one that best suits it.